don't be so hard on yourself and don't compare yourself to other students. Hey everybody, welcome back to my channel. My name is Natalie. I'm a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. And I also take a look at resumes and review personal statements, so if that's something you need done, please take a look at the description box down below and it'll tell you about the process of how that can be done. So for this video, I thought that I would address some students that might be scared or might be a little bit afraid to see patients on their own for the first time as a student in your new role as an NP. I know it can be very, very daunting. It can be very nerve-wracking because sometimes when you're in clinical, you can shadow your physician, and then after a while they say, all right, your turn, spread your wings and fly, you're on your own, you gotta see your own patient, and you might just be like, I don't know what to do, I'm nervous and scared. So I thought I'd just address that because I want you to know that you are not alone. It is a very nerve-wracking process, and I was very scared when I had to see my first patient. I remember my first day of clinical, I was there for a half day, and I saw a couple patients with a provider, and I saw a couple patients with other students that were there, and then the provider was like, all right, go see a patient. And I didn't really, you know, you don't understand what that means, go see a patient. I'm just kind of like, okay. So I went and I saw a patient, and this particular patient was here for medication refill. So, you know, I'm extremely nervous. I'm very timid. I've never seen a patient before, you know, as an NP. So, you know, obviously as a student. So I went in there and I just said, hi, I'm Natalie. I'm a nurse practitioner student, so I'm taking care of you today. So you're here for a medication refill. And so I think the patient saw that I was very nervous, and I just said, I'm so sorry, it's my first day, you know, I'm just learning how everything goes. So she was kind of actually helping me with the appointment, saying, you know, I don't have any side effects of the medication. I'm like, oh, okay, that's a great thing to ask, you know. So it took a while, and I asked her some more questions, make sure the medication was, you know, good. I forget what it was for, but make sure that it was actually doing what it was supposed to do and stuff like that. So then after that, I went back to my preceptor and I explained everything, and then we both went back together and finished out the appointment. But let me tell you, after seeing the first patient, that just brought down so much anxiety, because to me the anxiety that I think a lot of students have are based off the unknown. You know, you don't know how it's gonna go. If you're in a new clinical, you don't know how it's gonna go. You have to learn the preceptor, you have to learn your patients and your population and what you're supposed to ask and different diagnoses and medications and stuff like that. But once you get through your first day and once you get through your first patient, it is so much easier, because now you kind of know how you are going to take charge of the appointment, if you will. Of course, you're going to learn, you know, what you need to ask and specific things that you need to ask for each particular patient or different diagnoses and stuff like that. But I think people get scared in this different role, especially if you're younger. I'm in my 20s, and it's a little bit more difficult in terms of me having to take charge of the appointment, asking different questions and kind of doing that for patients that are older than me. It's a little bit kind of interesting, because I feel like if you are older and you've been in the field longer, you feel like you have more of the authority to deal with people either your age or younger, but it's kind of funny to ask, you know, people that are older than me different questions and take charge. So I think that's for me where I had a little bit of a trouble starting off because of the age and because of, you know, starting my first clinical and all of that. So it was definitely a very interesting time, but I did want to give some tips of how I kind of reasoned in my head of how to not be so scared after the first time, and I hope they can help. So the first piece of advice that I have might be kind of simple, but it's just remembering that your patients are humans too. They understand that you're a student, and most of the time, if wherever you have clinical, most of the time that preceptor has had students in the past. So these patients know that it's a teaching, you know, care facility, so they're not too taken off guard when they see a student. So they usually understand that, they know the process of how it goes, especially when you have those patients that come in every 3 months or, you know, pretty frequently. They understand that students are going to be there, so they don't give you as much of a, I guess, hard time, if you will, or they don't have all these high expectations. So you don't feel like you have to come in and bring this top-notch quality because you're not there yet in terms of experience and knowledge. So that's the first thing, is remembering that they are humans, and second of all, that they pretty much are aware that that particular place are going to have students. So it's not a total, turn off, or it doesn't take them off guard too much. The second piece of advice that I have personally, if it's your first day at clinical, get through the first day, get through your first patient, and that is your goal for the day. Because you might think, oh, I need to start learning about hypertension and this, what medications I need to prescribe, and how do I go through the process. For your very first day, just get through your first patient and get through your first day. So at least you know how the system works. How does that practice work? How does that preceptor work? What type of patients do they see? Their population, all of that stuff. Get through your first day, and I can almost guarantee that the days on, not that they're going to be simple, but at least you have your flow. You know how you present yourself, what types of questions you're going to ask, how are you going to chart right in the room, or are you going to chart when you leave? You kind of get an idea of how you do things. How do you do things in a quick way, in an efficient way, and getting all the questions you need to, address while you're in there in your visit. So get through the first day, and then your goal from the second day on is to actually learn what you need to learn to be an effective provider. Another piece of advice that I have, if you have the time and if your preceptor allows you, is to look at the charts of your patients for the day ahead of time, because if you're able to do that, you can kind of see what they're here for. If they're here for lab results, you can go ahead and check the labs. First of all, are they even in the chart? Second of all, if they are there any abnormal labs? And if there are, what were they before? You can kind of start prepping that chart, or having the questions in your head of what to ask, instead of going right in there, opening up the computer, opening up their chart and seeing what they're there for. And when they're there, I think you should have some sort of idea of what they're there for before they get there, so you can formulate your questions. And I think that will help the appointment go a little bit more smooth, and then indirectly you'll feel more confident about the appointment. So preparation is key. If there's something that they're there for that you may not understand, go ahead and do 5-minute clinical consult, look it up, or Google it or whatever, just so you have an idea of how your plan of care could go. And then that way, even if you don't know 100%, you can at least have some sort of information to give to your preceptor, so that they know that you're trying your hardest to actually find a solution to each patient's issue. So that's another thing, is prepare. And the last piece of advice I have that I know can be a little bit hard is, don't be so hard on yourself. It's hard for me to say because I was definitely very hard on myself as a student, even now going through my program, but you have to not be so hard on yourself, especially when you're first starting out. It could be a little bit more, I would understand a little bit more hard on yourself if this is your 10th clinical, but if it's your very first clinical and it's your very first day, don't be so hard on yourself, and don't compare yourself to other students. Each student might be in a different phase of their program. Each student may be in a different point of their life where they had way more experience than you. It is so easy to compare yourself with other students, let me tell you, because I've done it all the time, especially because my experience and other students' experiences are varied very differently. So I know it's hard to do, and it's hard to say because it's been trouble for me to not compare. But when you're in school, just try to remember that you're not trying to compare or learn more than your other person. You're just trying to learn as much as you can so that you can be a good provider to your patients. When you're seeing patients, you're not going to say, oh, well, so-and-so is better than you. You have to have all the information. And if you don't have the information, know how to get to it. But just try to compete with yourself, learn more each day, and that will really help you a lot. So thank you so much for watching another one of my videos. I really appreciate it. If you have any other ideas or anything you'd like me to address, you can email me or leave a description, leave a comment down below. Again, if you need any help with reviewing or looking over your personal statements or resumes, take a look at the description down below. I hope you guys have a wonderful morning, afternoon, night, whenever it may be. And remember to always believe in yourself. All right, you guys have a good one. Bye.